All right, so video two. This is I'm going to pick up from where I just left off, which is where I was out for surgery and kind of the surgery piece of that after the pre-op and all leading up to it. And it's going to pick up from me waking up in the ICU unit. And so, some of this is notes and things that I talked about with my wife while I was in the hospital that I really remembered. And some of this is things I had to be reminded of. So again, perspective is 20 days later, all of this was a blip in the screen, but I'm going to talk about what I really felt like at the time and my reactions, because I think that's important. This is my experience, and everybody's experience could be a little different. So we'll talk about that. So again, I moved into the ICU around 2 p.m., 2:15. I'm going off of what my wife remembers of the timeline, which I could think was a little foggy for her, understandably so. So I moved in to the ICU around 2:15, somewhere in that range, and then around 2:30, 2:45, she was able to come in to the ICU to see me. And so at that point, I was still intubated, still had the breathing tube completely hooked up. I'll again throw in some photos here to kind of show you that. But she told me I was already kind of waking up whenever she came in. My eyes were already kind of open, which was one of the things apparently was a lot of passerbys and nurses and all that were quite taken by that. Really within half an hour of being there, I was coming out of anesthesia, which is quite fast apparently, which I guess I'll credit to the fact that the plan for my anesthesia was spot on, because wasn't in there for a long time. My wife did mention throughout the day as she walked the halls of the ICU later, she would notice people that were still out of it and on the breathing tube and completely under still for hours. And so in that 30-minute wake up time, that's again seemed pretty quick. But as I was coming to, that's when I noticed and realized the breathing tube was there. Again, knowing that was going to come, that was one of the things I wasn't looking forward to the most. So maybe that's part of what it was, but I was extremely uncomfortable. I hated it. My arms were restrained, obviously, just so that I didn't pull that tube out of my mouth. My wife and mom both kind of had to help the nurse hold my legs, because apparently I was fighting pretty hard, knowing that was in my kind of in me. I can feel that lump that they talk about with the breathing tube. And again, in my mind, I remember knowing that I just have to calm down. I heard the respiratory person say, "Hey, we need 30 minutes of you being awake and alert, and then we can pull the tube out." And I just remember in my brain, I was just shaking my head. Again, I don't know how much of this I actually did, but I was shaking my head, trying to just say, no, get this out of me. I hated every bit of it. It was so uncomfortable. My wife said it really appeared that I was, afraid and those kind of things. And again, coming straight out of anesthesia, being under, and then, waking up with all that and being restrained, I'm sure I was quite afraid. But again, it was not fun. Again, looking back now, it was a blip. I barely remember it. I can kind of even laugh about it a little bit, but at the time it was quite terrible. I've heard from other folks that they don't even recall having it, and it wasn't that same experience. But again, this is what my experience was. And so overall, it seems like again, the timeline's a little bit fuzzy, but around 3:30 or so is when I was extubated. The tube was pulled out. And at that point, my wife said I kind of relaxed a little bit more. But, I just remember the feeling of relief for that. Still a lot of discomfort. I think a lot of that comes from the chest tubes and just everything that was in my chest, which I'll talk about in a future video. But I did kind of calm down, and then I was in and out. But again, I think just my mind and the build up and everything I knew. I think one of the first questions that I asked my wife was, "Hey, what size valve did they put in?" So again, that was one of the last things I said to the surgeon, and one of the first things I said to my wife as I woke up, which is, again, just shows where my mental state was and how I am. So again, quickly came out of everything, roughly, half an hour out of awake from the anesthesia, and then 30 minutes after that, extubated, and I was able to rest some. The rest of ICU is kind of blurry to me, but again, notes and comparing things. But I was in and out of sleep. I don't really remember a whole lot. I know I was very uncomfortable, very, very thirsty, and so lots of sips of water, lots of things like that. And this is all normal things that I had heard about and kind of expected, but I just remember ice chips and all those things were fantastic, but still just so thirsty. The night itself was rough. I don't think the pain was managed all that well. One of the downsides to, maybe this is just all healthcare at this point, is there is a nursing shortage, and felt that. So that each ICU nurse actually had 3 different patients, which is not ideal, but that's just how staffing is, and I can't say anything about that. The nurses that were there did great when they were there, but they were spread thin. I'm thankful that my wife was there for me to be able to be the advocate for me to do that, and I know that seeing other people there alone or without that, I don't understand really how they make it through. So if there's anything I can recommend, if you have a family member, someone that can be with you the whole time, that is great to have that advocate with you. But again, really rough night, just very uncomfortable. I don't remember a whole lot as far as details go, but I know I'd wake up in pain and was given pain medicine. And then it was the next morning at the shift change when the new nurse came in. My wife said she kind of realized that, hey, this pain had not been managed really well overnight. And at that point, she gave me the Dilaudid, which is, I think it's a narcotic of some sort of painkiller or something. I don't know exactly, but it was through an IV, and that seemed to work. She would give that to me, and it would basically knock me out, which I think is kind of part of the whole thing. Again, not a something you want to be on long term, but I was able to kind of rest there more. I guess throughout the morning they were kind of pushing and ready to get me up move me into the chair, but I think I must have kind of fought back on that, according to what my wife was telling me. But then, a little bit after lunch on day 2, so a little bit less than 24 hours, right at 24 hours after I come out of surgery, is when they first got me up out of bed, and that's that was a kind of a brutal process, but I knew it was something that was needed. But they issued my wonderful little heart pillow that I hugged onto and fought and stood up. And one of the things that still kind of bothers me today, it kind of effect, but what was tough during the hospital is when I stood up, my butt, my glutes, just like across the top, hurt so bad. It's like they had been locked up and clenched for I guess that whole 24 hours or more, but it hurt so bad, and I know I complained about that, but anyway, so I was able to move from the bed, stood up, then moved me to the chair, and at that point again it just felt like my whole body was turned inside out. Everything kind of hurt, but as I got in the chair and they put my feet back, it actually was more comfortable to me, and again with the pain medication that they had me on at that point, I was able to kind of rest more. And so I slept more. I talked a little bit to my wife that day, but slept more a little bit in the chair than I was able to in the bed, which was nice. And again, all these things are a little bit blurry, so I'm going off my notes. And then got word that, hey, I will be moving to the step-down unit, moving out of ICU. And so I think that happened around 8:30 p.m. that night. So before that, the nurses came in and had to remove IVs and catheters and all these things. And just an awful, awful experience. And that, again, my experience, looking back at it now, it's not. But in the moment, I was sitting in a chair, just had my feet up. I was not laying flat. Two nurses came in and said, "Okay, we're gonna lay you flat." And as they laid me flat, like everything hurt. And again, I think it's all the chest tubes and just everything being stretched out for the first time through here. It just was terrible. But to move me on, they had to. And so removed my central line, which didn't really bother me. A couple other IVs, I don't know how many I had in me. I felt stickers and tape being pulled off. And then I remember the catheter being removed, which was not a pleasant experience, but knew that had to be done. And then, pulling off the tape and stuff in my legs. But there was an IV line or something that was right here. And I don't know exactly what that was. I think I must have been already out whenever they put that in. But I remember when that was pulled out, like my whole body seized. Like it was super painful. I thought like my insides were coming out, and I don't know if it was just the culmination of everything or what, but it was pulling that line out, jumped, but had to get all those things removed so that I could move down move up to the step down unit, move up a couple floors. So got that done. At that point, I still had an IV in each arm, and then chest tubes and that kind of thing. But again, not a pleasant experience while it's happening, but it moved on pretty quickly. At that point, we got the clear that there was a room ready, and so the nurse and techs got ready to move me up. So I moved into a wheelchair, which again was pretty tough moving out of the chair for the first time. I remember they just kept saying, kind of shimmy with your butt so you can move closer to the edge to stand up. And I just remember, even for the first couple of days, like I don't know how to do this. I don't know how my body works, but obviously they were there to help me and push me and got me into the wheelchair. So that move, the ICU at this hospital was on the 6th floor, and I moved up to the 8th floor for the step down. Again, that was around 8:30, between 8:30 and 9 that night. I just remember the ride to the elevator, up the elevator to the room was just, kind of unpleasant because I was sitting in an uncomfortable fashion in the wheelchair, but again, moving on to the next thing on the step down unit. So I was able to get in. I think we got settled in about 9:45 that evening. And so that's really kind of my ICU experience, I guess, in a nutshell. Is, pain management took a while, very uncomfortable. Once I got moved to the chair, I was much, much more comfortable. And then, removing, a lot of the connections and things that I had before I moved up was, an experience that I won't forget, but at the same point has kind of, blurred in my mind, which is great. So from that point, I was, in the step down unit. And, my next video will talk about my stay in the step down unit, which ended up being, I think 6 days total there as they tried to get me ready for discharge. And I'll talk more about that in that video, but that's my waking up in the ICU and ICU experience, and we'll see you in the next video.